Okay, I think we can get started. So our guest presenter today is Nikki from the Massachusetts Health Connector, who is going to share with us more information about open enrollment, which is happening now through January 23rd, right, Nikki? Okay, fantastic. So I'll turn it over to Nikki, and if you have questions during your presentation, you are welcome to drop them in the chat, and we will come back to them at the very end of the presentation and address them all at once. So, Nikki, I'll turn it over to you.
Great. Thank you so much, Kelsey and Anissa. And thank you all for joining me today. I know it's a very busy time of year, so I'm just so appreciative that so many folks are joining this session. Um, so as Kelsey said, I'm Nikki Conti from the state's Health Connector, and I'm the Director of Outreach and Education here at the organization. So for today's session, my understanding is it's being recorded. So if you want to later on come back and review any of the information, you will have access to that recording. You will also get a copy of these slides. So really no need to take detailed notes. And at the end of the session, I'll be doing a demonstration of some resources that are available on our website. So again, you'll see lots of tools and I'll show you lots of different other resources so that if you have any questions, there are many different ways that you'll be able to get assistance. So let's get into the agenda. So I'm going to talk about open enrollment, whether somebody is applying or they need to change their health insurance coverage. I will also be giving you information about enrollment periods, so key actions, deadlines. Specifically, I'll be spending time talking about Connector Care. This is a plan that's unique to residents of Massachusetts. And then we'll talk about comparing plans and different ways that you can save money on your health insurance coverage. And lastly, I'll spend some time talking about different resources that are available. So I'm going to be sharing a lot of information with you today. For some of you, this is just, more of a refresher, reminder. For others, this might be the first time that you're going through this health insurance shopping journey. So I want to be mindful of that. All right, so first of all, I want to start with what is the Health Connector? I don't know how many of you are familiar with our organization, so just very, very quickly, background on our organization. We are the state's health insurance marketplace. So essentially, we're here to offer individuals, families, and small businesses who otherwise don't have access to affordable comprehensive coverage, the ability to apply, shop, enroll in coverage that's really going to meet their needs. So you might be wondering, okay, who are the folks really who are getting coverage through the Health Connector, and how are we different from Mass Health? So the Mass Health Organization is the state's Medicaid agency. I'll be talking about them in a little bit, but not too much depth, but essentially just as comparison to say that there were a number of individuals who, are in need or were in need of health insurance coverage in Massachusetts. They may, they may not qualify for Medicaid. They might not meet those income standards. However, through the Health Connector, if somebody who maybe has a couple of different jobs, et cetera, but doesn't get health insurance through their position, that's someone who would want to apply. Pardon me. A lot of people who get help, a lot of people who apply get help paying for that coverage, and I'll talk about the different methods of help that's available. You will hear me talk about health insurance over and over again, but I also want to acknowledge that we do sell dental coverage as well as at the Health Connector. And I briefly mentioned that we're here for small employers. So if you represent an organization that has fewer than 50 full-time employees, just keep in mind that you might want to look at our Health Connector for Business offerings. I'm not spending a lot of time today on Health Connector for Business, but if you want, we can certainly provide you information and a schedule of those sessions. Health Connector for Business doesn't align with the open enrollment for that individuals and families has. However, if you're a small business in Massachusetts needing coverage, you can enroll any time of year. All right. So, what do you need to know about all the Health Connector plans? So, it's really important for you to understand that all of the plans that we offer are comprehensive plans and they're known as qualified health plans. So, essentially, what that means is depending on where you live in Massachusetts, you'll be able to choose from a variety of well known carriers and shop among those plans that are available and really just transparently see, okay, what can I be purchasing? What is the premium cost? What are the other costs associated with each of these plans? Now, I mentioned that there are different types of costs or different types of savings that people can get through the Health Connector. Because with our state's health insurance marketplace, individuals and families can access federal advanced premium tax credits. So what does that mean for a regular person? Essentially, depending on your overall household composition, including the number of people in your tax filing household, if you will, as well as income and other circumstances, you may qualify for tax credits that simply reduce the cost of your monthly premium. You don't have to handle that exchange of money. You just pay the lower premium amount. Now, unique to Massachusetts, we have what's known as connector care plans, and I'll talk about that in a little bit more detail, but it's really for folks who are in certain income levels, meet all of our other eligibility requirements for Massachusetts coverage, and these are great plans, comprehensive, low or no cost on the monthly premiums, and no deductibles for any of the connector care plans. All right. So let's talk about open enrollment and closed enrollment, and just talk about what the differences are between these two. So during open enrollment, this is when someone can apply for new coverage for the coming year, or they have the opportunity to renew their coverage and shop for a new plan. Open enrollment begins on November 1st and it ends on January 23rd. But there are a couple of key deadlines, one of which is quickly approaching. So for someone who is newly applying for coverage for January 1, or someone who needs to renew their coverage and possibly maybe interested in changing a plan, you want to take action by December 23rd. Important to know, this is one of the ways in which we're different from Mass Health. Health Connector coverage begins on the first day of each month. And so if someone is seeking coverage for January 1, they're going to need to take all of their actions, including paying for that coverage, by December 23rd. Now, I like to show this slide just because each presentation we seem to be talking about COBRA quite a bit. And I just want to acknowledge that when someone loses access to employer-sponsored insurance, in most cases, they have an offer of continuing with their health insurance coverage, but paying the full cost for their COBRA benefit. And a lot of times that seems to be like the safest, most comfortable thing for someone to do. However, from a financial perspective, if someone loses access to employer-sponsored insurance, takes up COBRA, that would mean that they're paying the entire cost of that insurance plan without the employer's contribution. There are some nuances there from time to time. An employer might offer, some dollars towards that COBRA benefit for a period of time. Not always, though. So we like to just remind people that the Health Connector is here as an alternative. And before someone enrolls in COBRA, just to acknowledge that they can shop here to look for some potential savings. All right. So let's get into what do you need to do at this time? What are the very tactical things? So whether you are an existing member or you are someone who's newly applying for health insurance coverage, you'd be coming to the same exact website, which is mahealthconnector.org. This is one of the ways in which we're closely tied to the state's Medicaid system or Mass Health. in Massachusetts, we have what we call an integrated eligibility system. So really what that means is a person or a family enters information into this online application. If they're under 65 years of age, you can complete this information all online, and you will find out if you're eligible for a Health Connector plan, if you're eligible for help paying for that Health Connector plan, or in fact, if you're eligible for a Mass Health plan. So again, this is the landing page if you were either newly applying or launching to come back in and update your application. So, depending on who you are, again, an existing member or a new applicant, the steps that you need to take are really the same and the deadlines are the same. So you might already have an application with the Health Connector, but you might be thinking, well, things were a little different for me than I thought they were going to be for all of 2024. Or as I look ahead to 2025, things are going to be different. So you can, if you are an existing member, come in, update your application. Please, please, please do not create a new one. We don't want you to spend that kind of time, lock up your account, nothing like that. But essentially, get into your old application, make any modifications that you might need to make. If you're newly applying, you would come to that landing page, as I mentioned, and complete an online application. What I failed to mention on the last slide is just to acknowledge that the application is available in English. It's now available in Spanish as well as Portuguese. So if somebody needs to complete or wants to complete an application in their native language, they certainly can. Now, whether you are an existing member or newly applying, at the end of the session, you'll get a result, but you may see notifications that you need to send in documents or proof for particular parts of your application. So as an example, you might need to send in proof of income, or you might need to send in proof of residency. So you need to do that. I'm not sure if I said this earlier, I'll say it again. I'm not in my regular office, so things move and do things that I wasn't expecting them to do. So apologize for the Zoom slippery fingers here. Anyway, so if you need to send in documents or proof of any part of your application, you want to do that within 90 days. Now, going back to deadlines, no surprise here. All of these things need to be done by December 23rd so that they can take effect on January 1. So December 23rd this year is next Monday. So if anyone has questions, needs support, we'll talk about the best ways to go about that. All right. So what if you're newly applying? What are the requirements? So you need to be someone who's living in Massachusetts. You need to be a U.S. citizen, U.S. national, or otherwise known as lawfully present in the United States. And you need to be someone who doesn't have access to comprehensive health insurance coverage. If you are someone who's already enrolled in Medicare, already enrolled in Mass Health, or any other type of public health coverage, so for example, certain veterans benefits are comprehensive. If you have an offer of affordable comprehensive health insurance from an employer or you're incarcerated, you would not be applying as you have access to coverage. Now, what are the documents that you need? You would want to pull together critical information like Social Security numbers for you and anyone in your tax filing household, any immigration documents. And then we need to ask you questions. We will be asking you questions about income. So when you get to the questions related to income, you're going to be asked about current income as well as what your projected income is. So we recommend that people gather at least their last 2 pay stubs. If you are self-employed, and I'm thinking some of you may be self-employed, owner only is 1099, right? So you want to gather information about your net income. And then if anyone is collecting unemployment, there is a notice that you receive from the Division of Unemployment Assistance, and it's called monetary determination. It's basically the dollar amount that you're going to be getting from the unemployment assistance. So those are the kinds of things you want to gather. And again, if you don't have all of this information, don't worry about it. Submit what you have, what you know to be accurate, and then we will send you a notice. You will see a notification online of any proof that we need. Now, we're often asked about income sources to include. So when you are looking ahead and entering what you think you're going to make for an entire year, these are the kinds of things you want to consider. Are there wages that you can rely upon, a specific salary, tips, net income, unemployment, social security payments, alimony, any other taxable income? And then we have a complete list on our website. So if there's another type of income and you just wonder, okay, is that something that I need to incorporate into what is going to be my income for next year? Certainly we can look at that together. All right. Now, after you apply for coverage through mahealthconnector.org, we just really encourage you to open all your mail or any mail you get from the Health Connector or Mass Health. As I mentioned, because we share an application with Mass Health, sometimes people are surprised and they get a letter from the Health Connector saying they don't qualify for Health Connector coverage, but instead they qualify for Mass Health coverage. So certainly open any mail you get from either organization. And then throughout the year, we just encourage people to get comfortable with going back into your application. If you need to make any updates to it, absolutely go back in. You can update your, let's say your household composition changes. Maybe you had a dependent child and they are no longer, they left the house and no longer are keeping them on your, your taxes, or I know there are lots of different changes that happen throughout the year. So certainly we just ask you to get comfortable with going back into the application. Going in and keeping your application as up to date as possible really lowers your risk during tax time of owing the IRS any dollars. And as I mentioned at the start, you are eligible because you are coming through the marketplace. Many people find that they're eligible for advanced premium tax credits. And if someone is eligible for a tax credit, let's say of $300 a month or $400 a month, my colleagues like to remind people, this is a choice. You're not required to take that entire tax credit, but if you want to take some of it or none of it, that is your choice. But those tax credits are available so that you can help reduce the cost of your health coverage. And also, we have steps on our website to update income. So everything I'm going to be giving you, not only all the links are in this deck, but we'll be sending some additional links over to Kelsey and Anissa to share with you. All right. So let's talk a little bit more about the Connector Care program. So one of the ways that you can get help paying for coverage is, we've talked about advanced premium tax credit. So I won't go through that again. But I want to talk about how the Connector Care program is structured and how the savings are structured. Because a lot of times people will see the pricing and say, well, how does that work? Why are these monthly premiums so low? How can it be that there are no deductibles and there are these low out-of-pocket costs? And essentially that's because we take the federal tax credits that somebody qualifies for and we add state funds, and those two together reduce the monthly premium amount that somebody would pay. Now, for the last 2 years, we've actually, 2025 will be our second year. We are in a pilot phase of expanding financial support. So you're going to see, I think, even more support than you might have. You might be newer to this process, and I think you may be surprised at the dollars that are available to you. So, who are the carriers that are offering connector care, and who are the carriers that are participating in the Massachusetts marketplace overall? So hopefully you recognize some of these logos. I know we've had some health insurance carriers in Massachusetts recently change names and rebrand, but essentially you can see here the Blue Cross Blue Shield of Massachusetts, Harvard Pilgrim, Fallon, WellSense, and at the bottom here, we're listing the two dental carriers that we work with. So Delta Dental and Altus. And remember, depending on where you live, you're going to have access to different health insurance plans. All right. So I mentioned Connector Care having expanded eligibility and lower premiums, lower copays. So for someone who is making $75,000, $75,300 or less and meets all the other eligibility requirements for Connector Care, they could enroll in a Connector Care program. Also, for a family of four, the income limit has been increased to $156,000 for 2025. So we feel that this really is capturing many more Massachusetts residents clearly than we were able to capture before. So what are those costs looking like for you? So something I did not mention, but I think it's important to explain. When you're looking at this chart, you're seeing that you're seeing subgroups, you're seeing income ranges, and then monthly premium amounts. I don't expect any of you to have have FPL, your federal poverty level, having any of those numbers memorized in your mind. But I want you to know that the Connected Care program is broken up into three plan types. So plan type 1, 2, and 3 respectively. So plan type 1, if someone were in plan type 1, or let's say plan type 2A, if someone fell into that income range, their overall eligibility income range, they could enroll into a $0 plan. There are other plan options that they couldn't choose to enroll in, but that would be more money, but at a minimum, they have a $0 plan available to them. Now, taking into consideration as we move across, to the right of the table, if somebody were eligible for a plan type 3B plan in 2024, that plan would have cost them $142, the lowest cost plan. And then in 2025, the cost for that plan went up to about $147. But essentially, the bottom row here is showing you the lowest cost plan available in each eligibility category for Connector Care. All right. So I feel like this is the part that everybody waits for, and they're like, all right, this is great. But now how do I compare my options? How do I choose something that's going to be really good for me? So there are lots of considerations, and we always, whenever we talk to any like groups or we talk to people one-on-one, you can't stress enough how much of a personal decision all of this is. It really isn't just about the monthly premium that someone pays, but also benefits, out-of-pocket costs, network. So I think what you can feel comfortable with is, all the premium amounts are displayed. When you're going through, you're using our Get an Estimate tool, or when you're in your own application and you're looking at the cost, it's all transparent. Everything is there and visible for you to see. So the monthly premium cost, if the plan that you're enrolling with has a deductible, whether it's a $1,000 deductible, $2,000, or $3,000 deductible, that is listed there for you to see. Covered benefits. I mentioned that all of the plans are considered qualified health plans, so they are comprehensive. So you don't need to worry about that so much. But what you do need to think about is are there any particular medications that you personally need to take? So, you might think to yourself, well, I'm a healthy person. I maybe take one maintenance medication, maybe take one thing. Well, before you enroll in a plan, it's a really good idea to just confirm that that medication that you want to take is part of that carrier's medication or benefit package. Also, out-of-pocket costs. So depending on someone's income range, their age, they might be looking at costs overall and think, well, you know what? I'm going to enroll in the least, expensive plan available to me, excuse me. And I'm gonna take a catastrophic plan because I'm young. I'm 25 and I can do this. It's just really, really important for people to consider not only the cost of the monthly premium, but what are the costs if you needed to go to, urgent care? What are the costs if you need to go to the emergency room? What are the costs for medications if you are enrolling in a high deductible plan? And lastly, of course, it's the network. So are there particular doctors, specialists? Are there any hospitals, or maybe there's a health center near your home and you're like, that's where I go to get my care. I want to make sure I can continue to go there. So just want to acknowledge that these really are the 4 categories. And I'm going to show you how we can compare these items and the tools that we have. So we do have an estimator tool. Now this tool, I know this is a long URL, but essentially you can access this Get an Estimate tool from our homepage at mahealthconnector.org. And that's available at the very top on the toolbar, pardon me. And you would select Get an Estimate for individual or family. And you just enter some very, very basic information, and you'll be able to see what plans are available in the zip code that you live in based on what plans are there available based on the zip code, but then also based on your age and a guesstimate of your income, you can find out what the premium cost might be. So again, this is just an estimate. The real amount will be visible to you when you are in your application. Also, if you want to find out about a preferred provider, or you want to look at a certain medication, are these things available to me? You can use our plan comparison tool. And then lastly, the plan finder. What the plan finder tool really is the Get an Estimate and plan comparison tool combined. When you're in your own application, that's when you can use the plan finder. So on this page here, it also says when you're newly applying, or if you are a member and you're just going through the shopping process, you can go to our website at mahealthconnector.org/renew, and you can see all of these tools. You don't have to go looking through the site for them, but you can just get easy access to all of this information. All right. I think we've covered this in terms of enrollment, billing, and payment. Just need to say it out loud. Enrollment isn't complete until your premium payment has been received and processed if you owe a monthly premium. So keep that in the back of your mind if you're looking for coverage that begins on January 1. Remember, the deadline is Monday, December 23rd this year. This is what a paper invoice looks like. People do have the option of going paperless, and you do have the option of going paperless. You have the ability to make payments, however, through our payment center. You can still mail a check into us, or you can use a pay by phone option. Really important, we do not accept credit card. However, your checking or savings account number, those types of accounts are acceptable forms of payment. So if you use our online payment center or you're paying by phone, those are the numbers that you need to gather in order to make your online payment. All right. So you are probably, some of you, I can't tell, I can't see all your faces. So my assumption is some of you are wondering, okay, there's a lot of information. Is there any help that can be available to me? And the answer is yes, lots of free help available through customer service and community partners. Our phone number is listed here, and know that for during open enrollment, we have extended hours. So there'll be people available on Saturday, and we also have extended hours on Monday as we get closer to the enrollment deadline, as well as linked to local events. But as a matter of practicality, I would ask you to just think about your own situation and how like technically savvy you feel and how much knowledge you have about health insurance coverage, because you might want to connect with a community partner. We have about, let's say, I think 24 navigator grantees, and I think there are 50, they have 50 physical locations across the state. These grantees are able to help people with questions about their eligibility, the application, making payments, anything that you need support with, not necessarily just at this time, but also during the year. If you want to follow up and say, hey, I've had these changes in my life. Can you help me get into my account and make these updates? Particularly since we're getting close to the deadline, I would recommend that you go to our website and search for assistance in your area. And if you want one-on-one help, just make an appointment. There's still room on their calendars. They're still seeing clients. Navigators, as well as certified application counselors, can talk to you over the phone. They can meet with you in person. And some of them, have got pretty savvy with Zoom as well. So if you want to have a Zoom call with someone, they can help you do that as well. And then if anyone is trying to get more assistance related to Medicare, I wanted to just provide information about our colleagues from the SHINE program, and they are the experts in Medicare, which is a whole other kind of wheel of information. But before I get into the demo, maybe I could just pause for a moment and see if anyone has any questions. Does that work for you folks?
It looks like we do have a few questions in the chat. I guess I can just read through them. So Lisa's wondering if vision is included in the plans that we were talking about.
So there are some limited vision benefits available, but at this point, the Health Connector does not offer separate vision benefits.
Awesome. And then Jennifer's question, is there any breakdown shown anywhere in our accounts on the portion of a subsidy that is federal versus state? I'm concerned about federal credits going away with the next presidential administration.
Yes, I will show you in the demo that so you're able to see kind of what the state is contributing versus what the federal government is contributing. And also on your bill. So if you are a current Health Connector member, you can just look at your bill. Even if you have paperless billing, you can go into your portal and you'll see a copy of your bill, and you can see the portions of what is being given, I don't want to say given, that's not the wrong term, but how it's being distributed between state and federal dollars plus what you're contributing.
Amazing. And then Karen's question, do roommates count as your household number?
Great question. So when I talk about household, I should be careful with that word because it's a word we use. It's not necessarily a word that others use or may think about household differently. From an application perspective, we're just asking questions about your tax filing household. So anybody that you claim, or if you're part of someone else's tax filing household, you just want to be thinking, let's say you recently moved out of your parents' home and you are seeking coverage and you file your own taxes. hey, you should be filing your own application, and you may be in a position where you're getting access to more help because your income is now separated from parents or a parent. So no, roommate would not be considered part of your household. It's your tax filing status that we're interested in. And also, if someone is married and they're looking for advanced premium tax credits, they would need to be filing their taxes jointly with their spouse in order to be able to access these federal tax credits. All right, any other questions at this point? I think you might have some more questions after I do the demo, but.
Looks like we've got one more in the chat from Maribeth, who is wondering how you manage being locked out of a former account and not being able to verify through the email that was originally input for the login.
Yep. Great question. I would contact our customer service and ask them for support with your account. They'll be able to help you get into that. I know that, actually, just thinking about somebody I know who had this happen to them, they had a different, they changed cell phones, changed their number. So the number that they were pinging for the code, that phone doesn't exist, right? So I would call Health Connector customer service and they can help untangle that for you. But I would not try to create a new account. And the reason being is it's going to cause you errors because essentially it's your social security number. It's going to it's just going to bump up against issues and create more problems for you. I would call customer service and have them untangle the account lock issue for you. Okay, so I'm going to just present a situation and then go into some of the tools before. I'm hoping this is going to raise some more questions. So in this scenario, we're talking to a current Connector Care member and they're looking for a lower cost plan. So it looks like this person is still eligible for a Connector Care plan. They got some noticing from the Health Connector and it's their final eligibility notice. But honestly, when they got their bill, they were a little surprised. And just thinking about what is going on in their life and some unexpected expenses, they're just wondering if there's an opportunity to save some money on coverage by going with a different plan. So in this scenario, the person isn't currently using many services. Sorry about this clicking. They're not using many services. But they don't have a primary care physician that they have a relationship with, but they live in the Worcester area and they heard that they could get help at the Family Health Center of Worcester. And so we're going to look and see what tools we have available for them. All right, so we have someone, we're going to just plug in some information. This person is 36. They're making approximately $65,000 a year. Their zip is 01610, and they have asthma. And as I said, they want to go to Family Health Center of Worcester. So I'm going to see if this will allow me to go right to the page, which is great. So can you folks tell me if you're seeing the screen that says get an estimate? You are not. Okay, let me stop. Let me stop the share and let me just go about it this way and reshare. How is that looking for you now? Okay, great. So in this scenario, I'm looking for coverage in 2025. I'm going to enter zip code of 010. Okay. 010. 01610. 610. And then I'm going to say, I'm thinking it's going to be $65,000 for the year. And it's only one person, and this person is 36. You'll notice over here that there's some very, very simple filters. It asks you to indicate if someone is pregnant or if someone is disabled or blind, essentially because our state's Medicaid system has the ability, has programs for those who are pregnant or disabled or blind. So just they want to screen for that right up front so that people know that they would be going straight to Mass Health to look for support and coverage. So when I click on go to results, I get a disclaimer message that essentially says, as a reminder, this isn't a complete application. Anything that's shared here is truly just an estimate. I'm going to click on continue. All right. Let's just give this a second. All right. So in this case, in this person's scenario, it looks like they're not eligible for tax credits. However, they are eligible for connector care plans. And the cost is going to be about $200. The lowest cost is $264 a month. So I want to explain that to you. So if I click on preview plans, I'm able to see, and you folks let me know if you're able to see these. Okay, good. You're able to see in that area, these are all of the different carriers that are available to that person with those criteria in that zip code. Over to the far right, you're seeing that WellSense or Fallon or even Tufts Health Direct, those are looking like the lowest cost plans available to that person. However, if they chose a different carrier, presumably with a different network, the cost would be going up. Now, in this instance, I know somebody was concerned about advanced premium tax credits. So I would encourage that person to go to get an estimate tool, but it just so happens that in this instance, there is zero federal dollars being applied to the situation, but the savings are coming from state dollars. So I hope that helps someone understand the breakdown. So let's just say this person is, is saying, okay, well, these three plans look much more reasonable to me. I'm going to try to keep it to either WellSense, Fallon, or Tufts. We just want to find out, does the medication, I don't have, in this instance, the person doesn't have a primary care provider, right? But they do want to go to a particular health center. So let me go back to the Health Connectors homepage, and you can always do this by just clicking on our logo at the very top. Something I didn't point out because I went straight to the link, but at the top of our application or our homepage, you can see the Get an Estimate tool. And if I want to go to all of these tools, we have an area called the Resource Download Center. And I can use the Plan Finder tool. All right, so I'm going to type in phone 610, and I'm going to say, yes, I know I qualify connector care. Sounds like I'm qualifying for plan type 3. And I don't have a provider that I need to search for. So I'm just going to skip that one for right now. But I do hear that Family Health Center of Worcester is taking new patients. Okay, so I have that as a facility. And now I just want to plug in the asthma medication. So if you are taking any medications, really, if you're looking for something, just keep in mind our formularies include everything. So it's the name of the medication, the dosage, like what kind of form does that come in, and then the strength. So You're going to know this again, depending on your own personal circumstance. All right. So if you go back and you think about what we were comparing, you can see here that, and I'm going to have to close this for a minute. You can see here that every plan right here seems to be to have a family health center, except it doesn't look like Fallon has family health center. Now, my medications, it looks like that medication would be accepted by everyone except United. So I'm like, all right, let's take out Fallon. Let's take United out of the equation. And if I were trying to enroll in one of the lower cost plans, it would, for me, it would be down to, or in this scenario, it would be down to Tufts Health Direct or a WellSense plan. And the WellSense plan essentially is what was formerly known as BMC. They've changed their name to be WellSense, and they've expanded into multiple areas of Massachusetts. But that's how you compare the cost. If you wanted to, let me just see if I'm able to do this with the touch screen. This and this.
And sorry, Nikki, just to jump in for 1 second.
Sure.
In about 1 minute, we'll need
Oh my
to
goodness.
move to the
Yeah.
question in the chat and then move on to the next part of the program.
Sure, sure. So go ahead, I'm ready for you.
Oh no, if you want to finish where you were,
Okay.
or we can move to the question in the chat.
Okay, great, great. So I guess I just wanted to just share this with you so that you're able to see if you were comparing. So if you had said, all right, just based on premium, I'm going to stick with either Tufts Health Direct or WellSense, I can then compare a little bit more. So it's looking like, okay, this seems pretty comparable. I can get to the health center. They both have my medications. But this is interesting to me. My 1 month retail pharmacy. So if I went with Tufts, I would be paying $50 a month for that medication versus going with WellSense, I'd be paying 25. If I am doing an in-network mail order, it's 100 versus 50. So those are the types of things that we want people to get comfortable with and feel, like they're able to compare and contrast their options so that they know. I'll stop sharing now. Apologies, I wasn't really on the time. I was just kind of in a flow, but I do want to answer any other questions that folks have.
Well, this has been great and really informative. So thank you for all this information and these resources. I know we have a question from Mara Beth in the chat, and this will be the final question for now. But how do you manage being locked out of a former account and not being able to verify through the email I input on the login?
Okay. And Maribeth, I think this is something we touched on briefly, which was please, please do not create a brand new account because it'll cause more problems for you, for anyone. Because, you're using a lot of personal information, your social security number, any, other identifying information. So it's best to call Health Connector customer service. And that number is 877-623-6765, and just explain that you need assistance. Maybe you no longer have access to that email account. Maybe you no longer have access to a phone number that was associated with that account, and they can help you work through that issue. It is unfortunately a real issue, or we have right now, many of us, lots of accounts, lots of passwords. So hoping that can help.
Okay, and it looks like, thank you for answering that question again. I knew that there was another question somewhere in the chat.
I saw one from Nicole.
Yes.
But I'll let you look at it because I know you're closer to the world.
And Nicole, you're also welcome to unmute yourself and ask. I'm struggling to find the question right now. Okay.
Hold on. I thought I saw it pop up, but I'm not able to see it now either.
Oh, there it is.
Okay, great.
Okay. So Nicole writes, I'm trying to figure out how to submit gig income.
Okay. Um, okay, and then I think it just showed up on my screen. She was saying, so I don't have to pay back at the end of year. Okay, great. So if you are someone who is making, like your income throughout the year isn't steady, what we recommend is you give your best guess, but also make a commitment to come back into the application throughout the year and adjust that amount so that you don't owe at tax time. So for example, let's say you are looking at your 2025 application and you're thinking, all right, I think I'm going to make 25 to $30,000 in the first, I don't know, 5 months. I think this is what I think. So you enter that information in, the system is going to make a calculation, and it's going to make some calculations, but it's going to assume figures based on information you're giving the application. But you get to March or you get to April and you realize that's not what I made. I'm actually made less. You can go into your application and adjust your income down, just modify it, just update it. If you don't have any documentation to prove, my assumption is many of you are paying taxes on a quarterly basis. Is that a correct assumption? Like you might be filing as 1099 employees, you might be filing your taxes quarterly to keep. Okay, so I think it would be a good idea to actually go into your application on a quarterly basis and just update the application. So that it aligns with what you're submitting. If your income's fluctuating, but you don't have anything to quote unquote prove that fluctuation, you can submit an affidavit that basically says like I'm trying to think of the verbiage. I'm not an attorney. So it's something like under penalties of law, I'm attesting that this is my income. And then later on, after you've done your taxes, you could submit other formal proof. And I feel like there was one other question, and I'm also having the same issue, Kelsey. Like not all the questions are showing up for me. So if you can, is it clarification? Somehow one-time payments don't seem to register in the connectors number. Let me follow up on that, but I will also say our navigators are incredibly helpful with individuals who are working in the gig economy. So if you, Nicole, can you just indicate what area of Massachusetts you're living in or working in, and I can recommend a local navigator organization for you to reach out to. And maybe actually it would be helpful for me to just share this path with everybody. Let's go here. Let's go here. Because again, this is not just for Nicole, but for anybody who's looking for help in an area close to them. Okay, so let's just say I'm on any Health Connector page. Click on the logo and I'm back to our homepage. And I click on the help center. I choose find local help. And I'm going to assume that I'm looking for help as an individual or family. And I am going to type in, I'm going to type in a Medford zip code. So here you're seeing that we have certified application counselors at Lawrence Memorial, Mystic Valley Elder Services, Cambridge Health Alliance. But I'm trying to find a navigator. And certified application counselors can help you as well. Again, you just want to find people who are close to you that you can call. And you can also call customer service. I don't want to discount that. But folks at Joint Committee are incredibly helpful as well. And you can see all of the different languages they speak. So essentially, you may just want to call in and chat with them about your application, and they can also work with you and help you throughout the year, set up reminders. So you do go back in and update your application. Great. Any other questions?
Yeah, this is David. Can I ask a two-part question, please?
Sure.
Um, my wife is going to retire in the spring, so I'm going to lose my insurance. I
Mhm.
assume I can wait until March or April when this occurs for me to do this application. I don't need to do it now during enrollment, open enrollment.
No, David, you are 100% right.
Okay.
You don't need to do that now. What happens is, even though we're going to be in a closed enrollment, when you lose access to her coverage, you're going to qualify for a special enrollment period.
Okay.
So I would say it's actually 60 days, um, within 60 days before or 60 days after. So if you want to do it at like a month in advance, 2 months in advance, you can start the application process
Okay.
and then make your final decision for the month of coverage that you're going to need the plan to start.
And then the second part is she's going to be on Medicare.
Yeah.
So I only need insurance for one person, but for looking for discounts, is it our household income? In other words, will we need to add in like her social security to my income to figure out what discount I may get?
So are the two of you, do you file your taxes together?
We do.
Okay, so if you're married and you file your taxes together, you might be eligible for tax credits, but yes, you do have to count her income as well, so her Social Security. But you will just indicate on the application that she doesn't need coverage because she has access to Medicare.
Okay. Perfect. Thank you so much.
You are very welcome. And if she runs into any problems with Medicare, I'd recommend she reach out to a Shine counselor, or not even problems, but if she wants to talk through questions about which Medicare coverage is going to be best for her, certainly don't hesitate to reach out to a Shine counselor. All of that assistance is free as well.
Great. Thank you.
You're very welcome.
All right. And looks like we're at time. So Nikki, thank you again for sharing all of this information. As Nikki shared the top of the program, this is being recorded, so we are going to share this on our website afterwards, along with the slides that Nikki presented. And MassCreative has some other resources we will share there as well about recent advocacy efforts and things to pay attention to in early 2025. I am going to stop recording this. So if anyone wants to stay on and has questions about MassCreative's work, or if you want to talk through creative community organizing things that you are working through right now, Anise and I are available to be a resource to you. But thank you all again for joining us for our December Artivist Town Hall. This is a monthly series, so we already have our January series scheduled, and we're hosting organizers from the Berkshire Columbia Counties Pay Equity Coalition to talk about the work they are doing in those counties to end wage disparities for entry and mid-level cultural organization employees. As always, if you have any questions, you can just reach out to our team, and our email, our general info email is available on our website. And thank you again. We'll see you in 2025.